Rheumatic heart disease is an cardiovascular disease. Look at this picture, shows that rheumatic heart disease, heart valves, echocardiogram findings. Look at this. ECG findings detecting arrhythmias and cardiac abnormalities. Then chest X-ray assessing heart size and pulmonary congestion. Look at this size of heart. A detail going on. Introduction. Rheumatic heart disease is a chronic heart condition resulting from acute rheumatic fever, an inflammatory disease that develops as a complication of untreated or inadequately treated streptococcal throat infections. It is a major cause of cardiovascular morbidity and mortality, especially in developing countries. RHD primarily affects the heart valves, leading to severe complications such as heart failure and stroke. A definition. Rheumatic heart disease is a condition characterized by permanent damage to the heart valves due to repeated episodes of acute rheumatic fever. The disease results from an autoimmune response to group A Streptococcus infection. Etymology. The term rheumatic heart disease originates from rheumatism, which comes from the Greek word rheuma, means flow or stream, referring to the migratory nature of joint pain seen in rheumatic fever. It specifically describes the chronic heart valve damage caused by rheumatic fever and inflammatory disease triggered by streptococcus bacterial infection. Types. 1. Mitral valve disease. The most commonly affected valve leading to mitral stenosis or regurgitation. 2. Aortic valve disease. Aortic stenosis due to fibrosis and thickening. 3. Tricuspid and pulmonary valve disease. Less commonly affected but can contribute to severe cardiac complications. 4. Mixed valve disease. A combination of stenosis and regurgitation in multiple valves. Causes. The primary cause of RHD is untreated or recurrent episodes of acute rheumatic fever following group A Streptococcus, throat infection. The immune system mistakenly attacks the heart valve, leading to progressive damage. Risk factors 1. Repeated streptococcal throat infections. 2. Poor socioeconomic conditions. 3. Overcrowding and inadequate access to healthcare. 4. Genetic predisposition. 5. Malnutrition and weakened immune system. Complications 1. Heart failure due to valvular dysfunction. 2. Infective endocarditis, bacterial infection and damaged valves. 3. Arrhythmias, irregular heartbeats. 4. Stroke due to embolism. 5. Pulmonary hypertension. Pathophysiology. The term rheumatic comes from the Greek word rheuma, meaning flow or stream, originally describing shifting joint pains associated with rheumatism. Rheumatic heart disease specifically refers to the permanent heart valve damage caused by rheumatic fever, which results from an immune response to group A streptococcus infection. Pathophysiology of rheumatic heart disease step-by-step process. 1. Streptococcal throat infection. Group A Streptococcus GAS infection occurs in throat. If untreated, the infection may trigger an abnormal immune response. 2. Immune cross reactivity. Molecular mimicry. The immune system produces antibodies against GIS antigens. These antibodies mistakenly attacks similar proteins found in heart tissue, joints, skin, and brain due to molecular mimicry. 3. Acute traumatic fever development. Inflammatory response occurred 2 to 4 weeks after untreated GIS infection. Symptoms include polyarthritis, carditis, subcutaneous nodules, erythema, marginitum, and Sydenham's chorea. 4. Carditis, heart valve inflammation. Inflammation primarily affects the heart valve, especially mitral and aortic valves. Edema, fibrinoid necrosis, and Ascough bodies form in the myocardium. 5. Chronic valve scarring and stenosis. Repeated episodes of ARF leads to progressive valve fibrosis and calcification. The mitral valve is most commonly affected, leading to mitral stenosis or regurgitation. 6. hemodynamic consequences, stenotic valve disrupt normal blood flow, causing atrial enlargement, pulmonary hypertension, and eventual heart failure. Increased risk of arterial fibrillation and thromboembolism. 7. End stage complications, severe heart failure, stroke, infective endocarditis, and pulmonary congestion develops over time. Advanced cases may require valve replacement or heart failure management. This process highlights how an untreated bacterial infection leads to an autoimmune reaction that causes chronic heart valve disease. Signs and symptoms: 1. Shortness of breath. 2. Fatigue. 3. Chest pain. 4. Palpitation, irregular heartbeats. 5. Swelling in leg and feet. 6. Fainting or dizziness. 7. Heart murmurs detected during auscultation. Diagnosis: 1. Medical history and physical examination identifying post streptococcal infections, heart murmurs, and symptoms. 2. Echocardiography visualizing valve damage, stenosis, and regurgitation. 3. Electrocardiogram ECG detecting arrhythmias and cardiac abnormalities. 4. Chest X-ray assessing heart size and pulmonary congestion. 5. Blood test checking inflammatory markers ESR, CRP, and ASO titers. Nursing diagnosis: 1. Ineffective tissue perfusion related to valvular dysfunction. 2. Acute intolerance due to reduced cardiac output. 3. Risk for infection related to potential infective endocarditis. 4. Impaired gas exchange due to pulmonary congestion. 5. Anxiety related to chronic illness and its complications. Medical management: 1. Antibiotic therapy, penicillin or erythromycin to prevent recurrent GIS infections. 2. Anti-inflammatory medications, aspirin or corticosteroids to control inflammation. 3. Diuretics and beta blockers to manage heart failure symptoms. 4. Anticoagulants prevent stroke in patients with severe valve disease. 5. Surgical interventions, valve repair or replacement in severe cases. Nursing management 1. Monitor vital signs and heart sound regularly. 2. Educate patients on adherence to prophylactic antibiotics. 3. Encourage low sodium diet to reduce fluid retention. 4. Promote gradual physical activity within tolerance limits. 5. Provide emotional support and counseling. Treatment options 1. Medical therapy, lifelong antibiotic prophylaxis to prevent recurrent ARF. 2. Balloon valvuloplasty, minimally invasive procedure to open stenotic valves. 3. Valve replacement surgery using mechanical or bioprosthetic valve. 4. Heart transplantation in severe cases with end stage heart failure. Psychosocial medicine 1. Patient education, informing about disease progression, treatment, and lifestyle modifications. 2. Emotional support, counseling to reduce anxiety and stress related to chronic illness. 3. Social support groups, connecting patient with others facing similar conditions. 4. Financial guidance, assisting with resources for medication and treatment costs. 5. Coping strategies, stress management techniques, relaxation therapy, and mindfulness exercises. Prevention 1. Early detection, treatment of streptococcal throat infection with antibiotics. 2. Regular prophylactic antibiotics in high risk individuals. 3. Improving living conditions to reduce overcrowding and infection spread. 4. Public health awareness program to educate communities. 5. Routine screening in endemic regions for early intervention. In conclusion, rheumatic heart disease remains a major global health burden, particularly in resource limited setting. Early intervention through prompt treatment of streptococcal infections, secondary prophylaxis, and access to cardiac care can significantly reduce morbidity and mortality. Ongoing research and healthcare initiatives are essential to achieving effective prevention and management of RHD. Thank you. Have a nice day.